Okay, what other symptom will be if there is a very interesting case? Yeah, we find many all breakup people we find this term. And one of the best emotion is breakup only because every second day next, every second house there is some patient. If it's chronic one, then this will happen. The acute one, not that much. Okay.
Yeah, it will not show the depression.
Okay. The one suppressed emotions. The next one.
Trust issues.
Trust issues. Yeah. The next one.
Like they're always the people to say yes to everything. They've no boundaries. No?
Yeah, that's the good thing. They will not mix with anyone. Okay. The one thing, whenever they will meet some new people like this or some friend, for these people it's little bit to show them their real face. They are like internally they are broke up, like fully broken. Hey, how are you? You're so sweet. Oh my God, can I hug you? Yeah, you can hug me. Okay. Give your all problem to me. Okay, so they are little bit more access sweet. Actually, access sweet comes from many different tongue, but one of the part of this tongue also little bit of the access sweet. Okay. When we start a consultation, they will start first from crying, and they will cry a lot. During this consultation, they will cry a lot. People record a little video. Oh my God, I'm doing consulting, the patient is crying a lot, they are releasing their emotion. Actually, crying is not just releasing their emotions. Maybe they are just sharing the emotion, therefore also they are crying. Nowadays, why I am sharing this one, the crying, nowadays there are many therapy going on like this. Okay, they are like touching here and they start crying, their body is vibrating, and they use their video for the marketing. So people attract more to go and what will happen. Huh?
Then what is it? Like, why do they react like it?
Lots of the things. Somebody is like this only. Okay. I tried to 3 times. I said, what happened if you touch like this? I was like this, and they started touching. They are like, you do this. I started snoring. Okay. Some people have good energy. Some people having good energy, they can stimulate your chakras and your congestion energy. But I tried to 3 by my karma. I just found a fake people only. So then I said, okay, maybe this is right or wrong. But sometimes when you're using the acupuncture needle, okay, for this point, especially when you're using ST9, if you want some practical, maybe today one person will come. I'll show you. And we're using the range 6, 17. We are giving the moksha, so and they will start crying a lot. They will cry a lot. After that session, I'll not give any other session. This is enough treatment. Even they have some problems.
The young girl was,
When she came, she had lots of the issues. It's taken me lots of the time to make comfortable with me to her. She don't want to say anything. She was like foolish. So when she realized like we are not bad, we are not using your emotion to somewhere, and you are not judging through your emotion. Okay? So slowly, before our body was not responding to needle also. Okay? After 2-3 needles, I don't want to take more needle. This is enough. Okay. This is enough. After some time when she relaxed, then I explain a little bit about needle. If I insert this needle, this benefit will happen. So okay, one more needle. Okay. Slowly she started to take all the treatment. So it's like, sometimes it's good someone is broken, and do not misuse like our knowledge or something. Just try to help them without any expectations. So that will give you good result also and good karma too. Okay. Vertigo, dizziness in this condition happen more. Vertigo and dizziness. Okay. मृत्यु को क्या बोलते हैं? Epilepsy. Epilepsy case. Epilepsy is the purely the disease or you can say this is a health issue, is purely comes from your suppressed emotion. I try to find out many anatomy and physiology from the different articles, and this all nothing they mentions about. Someone is saying there is less blood circulation, less the sensation to brain, the many thing. But after lots of the articles read about the psychologist and how they explain with physiology, then I understand the epilepsy is purely comes from the stagnated emotions. Holding.
What
Done.
about kids? Pediatricals.
I read one very good article. Mostly I read many articles because childhood epilepsy. Okay, one of the doctor explains very good when kids is in the uterus now, and if that lady is having some traumatic situations and emotional situations. Okay, like this, and she are very afraid like this. She is holding, and in especially in the 9 month of your pregnancy, what emotions you are reacting, that same reason is going to your child, and after some time if you become normal, then there's not issues. But if you are holding for the long time, whenever my husband come after drink, he's slapping me. Now this is my turn to take the slap. Now this is if I do this, this will happen. They are holding. If they are feeling pain, they are not sharing their information. If they are having issues, they are not sharing their information. They are just holding everything. Especially in India, there are many joint family. Okay, and if there is 10 people, everyone's emotion is different psychology. In a joint family, that issues is happen more. So that's why there is one good trick. In India, whenever the new wife is pregnant first time, so what they are doing, this is a very good trick. After the pregnancy, that girls will not live in the husband house. They will go to the mother's house. Okay, after a long time I realized that. Okay, they will go to the mom's house, and because the girls always more comfortable with there. Okay, they don't have that much of emotions. If they have little bit issues, and they will say to their mama, papa this much. Okay, so they are more open. So maybe got very healthy. They will maybe yeah. Okay. So like one was the honeymoon. No, the real meaning of the honeymoon in India before was to after the pregnancy go out from your house. Do not live here. Mostly the girls will go sometime with her husband also with some the guru's ashram.
Tirtha Yatra.
Yeah.
Tirtha Yatra.
Yeah, in the guru's ashram they will get good knowledge from there. They will do good activities. So boy will born with good spiritualities. Okay, and otherwise, so this is happen like once I asked to my family, then I realized one of the in my family the ladies was close to everyone, and all lady after pregnancy going to their father and mother house for 9 months, but after that lady's pregnancy, that's not going there. And I, why she is not going there? Okay, and she said she is very close to us. How we can send her far away? Okay, then don't do anything. Live here. Everyone bring the food, this and that. I said, okay, this is the problems. Okay, because always there is some issues between a sister, husband, sisters, mother-in-law. Okay, there is little bit always going on. So that's why I don't like this one. I like this one. Okay, so maybe what's wrong going on outside? Should I come out or not? Okay, so what we are holding, again the baby is holding like the same. Okay, so childhood birth, I like that doctor. From all the childhood issues come through the emotions. Okay, if childhood is, he explained about the hearing also. Okay, I don't want to hear your voice every day. I don't want to hear your voice. The baby said, okay, if the voice is that much, bad, even I don't want to hear your voice. So this is happening more. That's why during pregnancy, give them good knowledge, comfortable zone, then baby will be born healthy. Okay? Vertigo and dizziness epilepsy. So vertigo and dizziness is like starting, that person's that they faint here. When we did treatment here,
Yes,
down
yes,
face.
yes. He didn't come back.
Yesterday he came in. Yesterday,
Yesterday.
day before yesterday. He came.
Day before.
No, I wasn't there. I was
He's not talking. If you ask everyone, he's like this only. He don't want to talk. He don't want to share.
Which one?
Vertigo.
Yeah,
Yeah.
Okay. So sometime, maybe not sometime, maximum time when we do the treatment for the epilepsy, no. Talk. Okay. Because all the emotions going to be. Sometimes they will start crying very loudly, like this. Okay.
When you're treating epilepsy and it just fades off, should you remove?
They will remove the treatment.
Yes, I did it.
Okay. And that's why all in epilepsy, doctor give the treatment only this only.
That I was young lady.
And again we do the same treatment?
For epilepsy, we do the same treatment.
We are giving some treatment, we are giving this contracted.
No, if patient faint, emergency point we use this.
And again we continue with the same.
No. If once patient faint or anything happened, stop. The needle is worked now. Within the, it doesn't matter during the treatment or after just 30 seconds, the treatment is worked. But it's very difficult. I tried 2-3 epilepsy case, some non or a non. Sometimes, for example, if I know you are very good in position and I am in good positions, and now you have epilepsy problems and you come to me, and all of your friends know me and I know you're all of the friend. When we are doing the consultations, you will be not, because if you share your weak point, oh, she's having this problem, maybe your all friend will know about this. So there is lots of the insecurity when they don't want to say that. Okay, so especially non people will not affect you that much. Unknown people, it will more affect you.
Sir, this epilepsy, it is a related brain problem, nerve, which is a neurological problem. Then when there is a simple thinking which is related to emotion, that is we thought it is a vasovagal shock.
Yeah, so what I'm saying, for example, like this only, when I read the articles of the doctor, he said, sometimes when you hold too much, you stop to giving the signal to your brain. Understand? And there is not enough connection between your heart and brain. That time sometimes it get. Otherwise, there is some type of the epilepsy that is different. They give some more name. That is means these muscles are more stiff, so that's why not good circulation in the brain. They explain like this. And if there is not enough circulation in your brain, in that time they give there is mild different. But they give there is 2-3. The epilepsy is divided into 3 parts. So mostly, yeah. So mostly when we see the contracted tongue, okay, and there is one more tongue when we will come on that, one color tongue. So in this condition, if there is epilepsy, that is more emotional one. Okay, if tongue is going like the what we call the diverting, like left, right, or upper like this. After that, there is epilepsy problem. That means there is some gray matter or white matter congested. Okay, for these people we use more crown. Right? But epilepsy also, normal emotional epilepsy also, of course we use the crown. Okay, this is the case. In this condition, what we use, the point are the same. REN 14, REN 17, ST3, ST9. What we use for correct tongue, no? Exactly the same point. And after this, we'll use the crown treatment.
ST.
ST9, ST3,
After crown.
REN 40 and REN 70. Okay. We'll add 2 treatment, one cardiac exercise, one the cardiac exercise, the cardiac, okay, the cardiac exercise, and second one is crown. Use the needle on the brain, no? That is a crown. Crown.
I saw that this tall guy yesterday. He was kind of like a
That is a crown. mandala, kundala, all
There's so many.
12 needles.
Huh? 12.
Yeah. It's called like triple crown. One round, one front, lateral, posterior, right lateral. Okay. Then second again one tune, then third again. So each and every tune part is stimulating your one specific part of the body. We will discuss about that. Lateral part is controlling the right side body. The right lateral part controlling left side of your body. The first one needle is controlling upper part. The second one is controlling your the middle part. And third one is controlling your whole body from down to up. And the front part is controlling mostly your frontal body. And the back part is controlling your back side and inner side of the body. We'll discuss about that. We have the tongue. Which side tongue is moving? The opposite side there is some issues. We'll discuss about that. Okay.
Can you repeat the protocol? Ren,
Range 17, range 14. These two are the move point. Okay. ST3, the cover point of your heart, and ST9. Okay.
ST, stomach.
HT. H means a heart. Heart rise. Okay. And HT9. H.
I thought
H for Hollywood. The Hollywood H.
And
Nowadays,
part 9 and part 3.
Heart 3.
So H, you should hear, very technically it is H.
Yeah.
We say H,
You say
it is
it's
H.
H.
S
Yeah,
H.
if you are Ajaya, Ajaya says H.
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 In India we have so many answers.
Yeah. In India, we have now one word from the different
Yeah,
technique.
depends on where we are from.
And Ren 14.
Then